Links 24 and welcome to Whitney's Health Check. I'm Whitney Sanjari, the Community Health Educator at Toma Memorial Hospital, and I'm joined by Jim Dunn from the Whitney Sleep Diagnostics and Consultants, who's here to help cover the topic of sleep, or the lack thereof. America the Beautiful is quickly becoming America the Sleep Deprived. The last Gallup study on sleep showed that on average, Americans sleep just over 6 hours each night, with 40% of those reporting banking less than the average. These numbers stand in stark contrast to sleep patterns at the turn of the century when Americans slept an average of 9 hours a night. Today, our culture of sleeplessness is fueled by screens and the internet, which provide more than enough opportunities to stay awake in our increasingly 24/7 world. So if you're feeling tired during the day or struggle to sleep at night, how do you know when a lack of sleep is due to an actual sleep problem? Jim is here to talk about sleep issues and when to seek professional help. Wonderful, Jim. Thanks so much for joining us.
Thanks for having me.
So, Jim, now, contrary to everyone, you're thinking, it's not my sleep center, right? No. So it's the Whitney Sleep Center that's Dr. Whitney.
Yeah, it's Whitney Sleep Diagnostics is an offshoot of the Whitney Sleep Center, which is run by Dr. Courtney Whitney.
Okay.
That's where it came from.
Yes, not my sleep center. Okay, so tell me a little bit, Jim, about what services people can receive in the Toma area for when it comes to sleep studies.
Sure. Well, Whitney Sleep Diagnostics contracts with hospitals and towns that just don't have the population to support their own full-blown sleep program.
Sure.
So prior to Whitney Sleep contracting with Toma Memorial in 2010, patients would have to drive to either, any of their surrounding towns, La Crosse, Eau Claire, whatever the patient and doctor decide on. So we are able to do both diagnosing sleep disorders, follow up with a board-certified sleep specialist, right, just with the patient staying in town, and that's done via telemedicine. And then we also are able to initiate therapy. So if the patient chooses to use Whitney Sleep for their CPAP equipment, if they're being prescribed CPAP, we can take care of them right in town as well with hands-on local support for that.
Oh, wonderful. Okay, so let's kind of dive a little bit into what exactly happens during a sleep study.
Sure.
And what is a sleep study?
Sure. Well, generally speaking, a person is going to be recommended for a sleep study if there's actually, this might be a good time to kind of show the screening form.
So I'll lift this up here if we have, and we've posted this online as well. This will be available online if you want to know kind of just this quiz. This is like a questionnaire you can take, right?
Yeah, basically if a person answers yes to 2 or more of those questions, they would be a good candidate to talk to their healthcare provider. Okay. They can be referred from their healthcare provider locally here for a sleep study.
To a sleep study, okay.
Yeah, so and once we receive that referral, then we kind of carry the ball all the way through to the outcome that the patient is seeking.
So some of those questions on there, in case viewers couldn't read it, so do you snore? Yep. Are you excessively tired? Have you been told you stop breathing when you sleep?
Yeah, that's a big one.
Okay.
And I think a lot of us see, people, after Thanksgiving or whatever, they kind of nod off on the chair, and then, some people will snore, but they've got a great breathing pattern. But when they stop breathing, so it's snore, 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 and then it's quiet, that's when you basically your airway, generally speaking. Okay. I'm not diagnosing anything right here.
Okay, sure, okay.
I'm just a patient and the sales guy. I'm not a clinician, but in obstructive sleep apnea, what happens is the muscles of the airway collapse. It's kind of like kinking a hose, if you will. So air can't get through. So what's dangerous about that is when you stop breathing, your heart rate begins to decline, your blood oxygen level begins to lower, and then at some point your body will arouse you from sleep to be able to open that airway up again, and then your heart has to work a little harder to be able to bring that blood oxygen level back up to where it should be.
So what you're describing, that's sleep apnea, right? What you're describing?
That is an apnea, yes.
Okay, so people they're in the middle of sleep, and then they stop breathing, and they're not able to breathe, their airway constricts, and then so there are things to do that can fix that, but that's really hard on the body, right? To not.
Yeah. Well, if you look at it this way, moderate sleep apnea is anywhere from, I think it's 16 to 24 apneas in an hour. Okay. So in the sleeper isn't typically aware that they're arousing from sleep. The person they're sleeping with definitely knows about it because it's very disruptive to their sleep as well. So if you do the math on it, 20 times an hour, just kind of carry that out as long as you'd like to, until you become uncomfortable with the fact that I'm missing out on good quality sleep.
Sure, so I'm going to cut you off there because
Sure.
we're running short on time. So sleep apnea is a sleep condition that can be treated. People
Yes.
might know if they check out that survey, that might tell you that you might have a sleep condition where you really need to seek extra help. Right. And then what you brought in real quick, what is this?
This is a CPAP machine. This is my public service announcement.
The PAP, yeah.
It's pronounced CPAP.
Not CPAP.
Yeah,
okay,
really
CPAP.
what it stands for is continuous positive airway pressure. What we do is we apply that air pressure to keep the airway open, help the sleeper breathe all night.
So then they can sleep soundly, get a better night's rest.
Yep.
All right, wonderful, Jim. Well, you can find more information about sleep studies at tomahospital.org. And when we come back, April and Cody will be filling you in on what's coming up in your community. Don't go anywhere.